speaker. I am a parent of a daughter who has major depression disorder and anxiety, and a son who has ADHD and anxiety. I struggle with the fact that we call ourselves behavioral health because behavior indicates a choice. Behavior indicates that I have a choice about how I'm going to behave or what I'm going to do. And some of you in the earlier session heard me say we have not done ourselves any favors by differentiating behavioral health from health. Because as somebody so eloquently said, the brain is one of the major organs in our body. So why can't we treat it like any other organ or disease?
We know that if people have a chronic lifestyle-related illness, you could pick hypertension, you could pick arthritis, you could pick COPD, you could pick diabetes, and they have a comorbid psychiatric condition. You could pick depression. We know that it's going to cost about 3 times as much. Well, what are we doing about that?
But I have 4 kids. My now 19-year-old is in recovery, but went through his abuse and addiction through really 4 years of high school. My primary issue here is that the insurance that my employer paid for and that I paid premiums for, and I ultimately paid about $1,500 a month in COBRA payments for, my insurance paid almost nothing over many years of treatment and recovery and multiple modalities for my son.
There's challenges at all levels, and sometimes those of us with some means and good health insurance wish we had Medicaid because the cost of caring for high needs individuals in our own families is extraordinarily high and extraordinarily hard to reach.
First, I've learned the value of being a true community partner. We are so much more than just a provider of services, but truly a partner who comes to the table with other community partners to solve challenges, to hear the challenges of the community that are constantly evolving and changing, and knowing that we cannot face these problems and find solutions as individual organizations, but that we have to come together to do that.
In the last 6 months, I've lost 3 nephews to overdose. And 7 months ago, my nephew, 4th nephew, went to McDonald's in New Mexico, and his car was hijacked after they murdered him in the parking lot with his son. And this was all related to opioid use or abuse. Why can't we invest in rural Colorado?
Is we identified that there's too much randomness in our system. People walk in a door, they may need lithium or they may need marital therapy, and they walk in that same door and they get put in the same queue. Essentially, we got the wait time down from 8 weeks to 4 days. So giving the patient, and I'll use whatever term people like, the patient, the client, the consumer, their preference of evidence-based treatments is the first starting point.
When we serve in uniform, we have one vision, one mission. We aren't competing against each other. Family advocacy is not competing against substance use services, is not competing against mental health, competing against primary care. We are working as one team that wraps around the care of an individual and/or a family.
So what I hope we come away with out of this task force is not a grandiose idea that can't be implemented, but that we identify some key elements that continuously rise to the surface and create challenges for families and individuals across Colorado, and we hone in on those and we put all this wonderful brain power and heartfelt energy into solving those key issues.
Why we didn't figure out that the head was connected to the body 100 years ago, I don't know, but we didn't, and we're finally figuring that out. And to Kelly's point and other points, the different payment streams follow the money. It is really, really that simple. If the money drives the behavior you want, it will happen.
But what we've started to pilot is a triage tool. And again, believing in no wrong door, if anybody walks into our FQHC partner, they absolutely get a behavioral health assessment because our FQHC partner does a great job at doing integrated care. And if they walk into a door at MINDSPRINGS offices, they absolutely get a clinical assessment, and we do a great job. And then we ask ourselves the question, which system is this person's needs better served? And we try to triage based on the person's need, and of course choice comes into the equation.